Hi, welcome to the audio slide presentation. My name is Dr. Bishal Gyawali, and today I'll discuss about our review paper published in Critical Reviews in Oncology Hematology Journal titled Continuous versus Intermittent Docetaxel for Metastatic Castration-Resistant Prostate Cancer. Two pivotal trials established 3-weekly docetaxel as the standard chemotherapy for metastatic castration-resistant prostate cancer by showing a survival advantage of around 2 to 2.5 months compared to control. These two trials used 10 cycles and 12 cycles of docetaxel. Docetaxel use was also associated with some significant adverse events, as can be seen from this table. In daily practice, it is a big dilemma regarding the optimal number of docetaxel cycles that should be given to the patient. Many administer docetaxel until disease progression, which is called the continuous approach, but given many adverse events associated with docetaxel use, some prefer giving a certain number of docetaxel cycles, then allowing for a treatment break called the chemotherapy holiday, and then resuming docetaxel on evidence of disease progression, the so-called intermittent approach. In this review, we tried to summarize the literature and the available data regarding intermittent approach of docetaxel for metastatic castration-resistant prostate cancer. As shown in tables 1 and 2 of our review, we found a number of studies that assess the feasibility of intermittent chemotherapy in this setting. However, as you can see from this table, these studies are widely heterogeneous in terms of the dose used of docetaxel, the criteria for providing chemotherapy holiday, the criteria for resuming chemotherapy after holiday, and so on. Thus, pulling data from these studies was not possible, but we can definitely see from this table that a good number of patients enjoy long chemotherapy holidays, and some patients can enter even into second and third rounds of chemotherapy holiday. This is table 2 of our review, and from this table we can see that most of these studies that assess the feasibility of intermittent chemotherapy for metastatic castration-resistant prostate cancer, these studies are mostly single-arm phase 2 or retrospective studies. But we can also see that the quality of life has greatly improved by taking chemo holidays in most of these studies, and the authors of these studies have concluded mostly in favor of intermittent approach. So, why are we having this debate of intermittent chemotherapy versus continuous chemotherapy? This is because intermittent chemotherapy has many benefits to the patient. With intermittent approach, patients get chemo holiday, and from those previous studies we have seen that this chemo holiday for some patients can be as long as 8 months. And being off chemotherapy is a great feeling to the patient, which we all know from our clinical practice. With chemo holiday, with that treatment break, the toxicities of docetaxel slowly decrease and fade away, and the quality of life of patient increases. The patients, they don't need to take job leaves, they don't need to pay for the chemotherapy and the doctor fees and the transport to the hospital, and thus this helps in decreasing the overall cost of treatment. And this is very important, especially for patients living in low-income countries. Also, although this has not been validated yet, some studies have suggested that intermittent chemotherapy could possibly prevent the development of resistant tumor clones. However, there is the risk of rapid disease progression during chemo holiday, and this can be a matter of anxiety to some patients. Another caveat is the lack of well-defined criteria for starting chemo break and defining the duration of chemo holiday. There is no well-defined criteria for initiating chemo holiday and for resuming chemotherapy after the holiday. In conclusion, most of the studies of intermittent chemotherapy in castration-resistant prostate cancer are small single-arm phase 2 studies and retrospective studies, and therefore a strong recommendation cannot be derived from these studies. Nevertheless, they do suggest the feasibility of intermittent approach that offers improved quality of life to patients. Intermittent chemotherapy should be offered as an option to eligible patients during informed decision-making process. A randomized controlled trial comparing these two approaches head-to-head is highly desired. Thank you very much for listening today. Please study the full paper for detailed discussion of these issues.